Medicaid expansion has long been an issue that's divided the Florida Legislature. This week, the state's Senate Committee on Health Policy approved a comprehensive proposal to allow the use of billions of federal dollars to fill in a health care coverage gap that affects about 800,000 low-income residents. This proposal would introduce a state-run private insurance exchange available to Florida residents who earn less than $16,000 annually, or about $33,000 for a family of four. Aside from covering the uninsured, supporters say filling this gap could fund hospitals and create more healthcare jobs throughout the state, causing great positive economic impact. But first, the proposal needs to pass in the more conservative Florida House, and many are doubtful that will occur. Joining us to discuss this, we welcome Fabio Andrade, a member of a Healthy Florida Works, a bipartisan statewide coalition dedicated to extending health care coverage. Fabio, good to see you.
Nice to see you too. Thank you very much.
This program is very interesting because it goes back to something that's been discussed, and in Indiana, it has just been recently approved by their legislature. The Republican Governor Mike Pence, I think, was the champion behind it. And the idea is that in order to help those who don't qualify for subsidies under Affordable Care Act can qualify for some assistance in the form of federal dollars by expanding Medicaid as we see it today. Yet, the House of Representatives very reluctant. How do you see it?
Well, very important. This is not a Medicaid program. This is a Florida responding to a desperate need to help small businesses and to also take care of the people that are not covered. In this, over 800,000 people. So the program is very good because it teaches us personal responsibility. It helps the individual to be involved and also gets those federal dollars that are going up from the state that doesn't come back. So we have to make sure we get a program that is very effective and is consumer and you know, responsibility is there. So we have great leadership in the state of Florida right now with the Senate, and which is going very well. And definitely, we have no doubt that the Florida House will also support this activity because it's needed. We have to respond to a desperate need. There is a situation that the state of Florida needs to move forward. Also, making sure that we don't create an entitlement program that then we are burdened with whatever happens in the future. This will be a bill that if something will have to happen at the federal level that they will not fund it, the program already immediately is suspended. So that's where we at today, and I think is the best program put together so far in the last few years that makes sense, which is for small businesses to respond to the need, for the people that are needed, the low-wage people get coverage, and that makes it a personal responsibility together with the state and getting the dollars back. Helen, is key.
Of immediate issue is that the low-income pool dollars, which is a federal program known popularly in those bureaucratic circles as LIP, that is going to be eliminated. And the federal government is strong-arming states that have not expanded Medicaid in order to make some type of concession to be able to take care of those who are not able to buy health insurance. It's calculated in Florida, 800,000, maybe up to 1 million people that we're talking about. But this program really establishes, when you say you talk about personal responsibility, is because you're establishing a voucher program that these dollars go into private healthcare accounts, and then you go out with that and manage your own healthcare with those dollars.
Basically, what it is that the person has to take responsibility, that there will be a co-payment, whatever they do, and based on their income, there is a percentage of how much of the monthly, you know, participation will be on the healthcare program.
My understanding is that depending on income, it could fluctuate anywhere from $3 to $25 a month.
That's what it is, and it's
amazingly
very reasonable.
reasonable,
and it's you know, the co-payment is very small as well. If the first visit is $5, the second visit is $20 in a hospital. So it is a great program. I have to recognize that the leadership in the state and the Senate, you know, Rene Garcia and Maritere Flores,
both senators from Miami-Dade County.
All three from Miami-Dade County have been very good about this, and especially the president, President of the
Andy
Senate,
Gardner.
Andy Gardner. He's been very key to put this in a situation where we can move forward unless something happens with this factor that is very needed. You know, I've been reaching out to the community, to small business organizations. I've been reaching out to chambers of commerce. Everybody wants something to be done. And the main thing is we need to make sure that bipartisanly we move this forward and get it done quickly because it is needed for our state. You know, it will create jobs. It will create jobs.
How does it create jobs?
Well, with the fact that it is going to take the possibility of getting people in the system grows, and therefore is going to be needed to attend all these people. I mean, if you're talking about 800,000 people more attending, you know, hospitals, clinics, and everything else, that is automatically a booster. And these dollars that generated to these systems will be used in the community. So it does help a lot, and also it will maintain some jobs in the small businesses that, you know, they don't have the burden now to pay penalties as well because they cannot give coverage to the low wages people in their institution. So I think it's very positive. I think we're going in the right direction, and we thank you for giving us the opportunity to reach out to more people. We want chambers of commerce, we want organizations to get involved and help us to move this forward.
One of the issues that has to be addressed is that if this is not approved by the state legislature, not only do you have the issue of still too many who are uninsured or underinsured, but you also have the issue of the crises that this will present to public hospitals, which are considered safety net hospitals that assist many of those who are uninsured or underinsured. And the cost to Jackson Memorial Hospital could be approximately $160 million. I believe Tampa Bay General Hospital could be upwards of $500 million. It's a lot of money at stake. And residents and taxpayers are going to have to pick up that cost one way or another.
Right. And the key is that the federal dollars are going up and they're not coming back. So this is a win-win situation for everyone. You know, it's for the state to make sure we get the fund for the taxpayers to get the money back from the federal government, to get also accountability. I want to reinforce that this is a program that is going to get the people involved and make them responsible for that. And another thing, when you have insurance, you know, you don't wait until you're very ill and the cost of health care goes up. If you have a program that you could go to the hospital and as soon as, you know, you start getting sick, and then, you know, the coverage is a lot sooner, therefore it doesn't go to the next level. So that is very important.
You know, in reading about this, I was reading that one of the requirements is that you have to be employed.
Yes.
Or looking for work.
Looking for work.
Or for a student.
Yes. Yes.
So that's part of the responsibility component?
At this time, that's where it is, yes. That is very important that the person must be employed and also or be an educational system. And I think that's important. You know, we want to make sure that people take, I reinforce a lot, responsibility. You know, we have to make sure, and we have to give them the support in that regard.
Is it focused more for families or for working adults?
It's for both. It's for both, because the family also could be in the low wage and the Florida, you know, poverty level that they need to have coverage. So it is key. In the program, the monthly payment is based on that as well. You know, how big is the family, and it covers up to 4 people.
To me, it's so gratifying to see the different business leaders and chambers of commerce. Though at the point of this taping, I believe that the Florida Chamber of Commerce is not supporting the program. I could be wrong, but and that's a question for them as to why they aren't. But a healthy workforce is a healthy economy.
Yes.
And I think this is basically speaking to that.
Yes, no question about that. And also, Helen, there's been a lot of concern of small businesses in regards to, you know, covering their people. You know, I think small business will support and are supporting this activity because we need to make sure that we respond to a need in the state, which will become chronic if we don't do something about it. So we all have to take responsibility. Something needs to be done, and we hope that our legislature will work out some kind of agreement that with what the Senate passed and now the Houses look forward, we could find a very good comprehensive program that doesn't become necessarily an entitlement program, but a program with responsibility where we take care of our people in a state, and which is part of our responsibility.
And one of the things that's so important about Florida in particular is that we don't have a lot of Fortune 500 companies. And you keep mentioning small businesses. Small businesses is what really makes our state thrive. And it's very difficult to be able to afford health care as it is. We do have to think very creatively, how can we make a program that is absolutely our own? One of the interesting components, because Florida would be developing its own health care exchange, so to speak, is that regardless of what the Supreme Court decides in June regarding the Affordable Care Act, this could still survive that judicial test.
Well, it should. It should, because it's something that we need to do in the state of Florida. This is very key in regards to that. So we have a situation that we have to respond to it, and I think all of the key components have to come forward. And, you know, if people want more detail, Helen, they could check our website, you know, healthyflorida.com. It's very important that people will look at all the details are there that I just don't have them with me, you know, at this moment, every single detail, which is a lot of information.
We do have a quick, just to talk about a local impact. Miami Mayor Tomas Regalado said the following: this bill in the Senate does something, but it doesn't do everything. For Miami, it's important because there are thousands of people here that do not have health care coverage, and that will be a brunt for the city. There are residents, they are our residents, so we have to take care of them, end of quote. And that's ultimately the issue, that you can bury your head in the sand, but the problem's not going away. Even if it is approved by the legislature, and some are really questioning whether that will occur, even if it does, then the negotiation has to start with the Obama administration. My sense is that negotiations are occurring simultaneously because of the pressure put on public hospitals.
No question about that. I mean, you're the expert there, so I'll take that for
well,
an answer.
Well, there's nothing like a crisis where we are talking about a $1 billion surplus for the state that could become, if nothing happens, a $2 billion deficit overnight.
Yes.
Nobody wants that.
No question about it, and that's why we want to get out there. I'm touching doors and talking to people to get involved.
Fabio Andrade, thanks so much for joining us today.
Thank you very much for the invitation.
And I'm Helen Ferre. Thank you for watching. See you next time. It has just been recently approved by their legislature. The Republican Governor Mike Pence, I think, was the champion behind it. And the idea is that in order to help those who don't qualify for subsidies under Affordable Care Act, can qualify for some assistance in the form of federal dollars by expanding Medicaid exchange available to Florida residents who earn less than $16,000 annually, or about $33,000 for a family of four. Aside from covering the uninsured, supporters say filling this gap could fund hospitals and create more healthcare jobs throughout the state, causing great positive economic impact. But first, the proposal needs to pass in the more Medicaid expansion has long been an issue that's divided the Florida legislature. This week, the state's Senate Committee on Health Policy approved a comprehensive proposal to allow the use of billions of federal dollars to fill in a health care coverage gap that affects about 800,000 low-income residents. This proposal would introduce a state-run private insurance aid as we see it today. Yet, the House of Representatives very reluctant. How do you see it?
Well, very important. This is not a Medicaid program. This is a Florida responding to a desperate need to help small businesses and to also take care of the people that are not covered. In this, over 800,000 people. So the program is very good because it teaches us personal responsibility. It helps the individual to.
Conservative Florida House, and many are doubtful that will occur. Joining us to discuss this, we welcome Fabio Andrade, a member of Healthy Florida Works, a bipartisan statewide coalition dedicated to extending health care coverage. Fabio, good to see you.
Nice to see you too. Thank you very much.
This program is very interesting because it goes back to something that's been discussed, and in Indiana,